When my next guest lost her grandmother due to a medical misdiagnosis, it led her to pursue a career in medicine. She wanted to help others avoid the same kind of heartache. Dr. Carnai Simpson is a family medicine physician at Modern Primary Health Care under the umbrella of Modern Heart and Vascular. Good morning.
Good morning.
All right, let's go to that misdiagnosis that your grandmother had and take us back to that moment when she was experiencing something and no one seemed to know what, and then you got the news.
So during that time, I was actually in my senior year of high school, and she was experiencing stomach pain, you know, just not feeling right, and she was going to her primary care physician. They couldn't figure it out what's going on. Eventually, you know, during that time, the colonoscopies weren't like as prevalent, or just people just weren't as educated. Absolutely. And so during that time, by the time she was diagnosed, it was already far advanced. And so she actually passed away beginning of my freshman year of college. And so that was like a motivating factor for me in emphasizing preventive screenings and pursuing medicine too.
Yeah, because today you can almost have 100% of survival if you catch it early in the colon, right?
Absolutely.
Yeah. And the thing that people should be concerned about is that younger and younger people are being diagnosed with it. Mm-hmm. All right, primary care physician. So many people end up in the specialist office, which means they passed go, right? Right?
Yeah.
And by the time you're in a specialist office, you got something probably that's advanced or very specific. And so the primary care physician can oftentimes interrupt it from getting to that point.
Absolutely. Our goal is to emphasize preventive medicine. We promote annual physical exams, and I even start with my patients as young as 18 to go ahead and see me once a year to get their annual physicals, and that's when we emphasize getting the preventive screenings. We screen for hypertension, we screen for high cholesterol, depression, and all of those.
Yeah, so when you say as young as 18, the crazy thing is that with diabetes, for example, we used to call it adult onset, right?
Yes.
Now we just say type 2.
Yes.
And the reason why is we're seeing a lot of kids with type 2. So those screenings, you can never be too early on some of those things.
Absolutely.
Okay. This makes so much sense to me that we're adding primary care under this umbrella, because I remember a cardiologist saying to me once he was tired of showing up to the hospital with people with advanced cardiac disease, but the reason why they had the cardiac disease is because they had type 2 diabetes, and which is diabetes is one of the number one reasons for heart disease, right? This is something that you can interrupt.
Yes, so with seeing us family physicians for preventive medicine and emphasizing getting things taken care of before they get to the advanced stage or the disease state, we can help to prevent a lot of that advanced disease. Now, in working in collaboration with the cardiologist, the benefit, heart disease is the number one killer in the United States.
Men and women around the world, yeah.
Absolutely, and so with collaborating with the cardiologist, they're doing their preventive side from the cardiology standpoint, and we are leading them in that direction too, and working very well as a team together.
Yeah. So screening age guidelines, you mentioned you have some patients, as young as 18, but unless you have family history or unless you notice changes, you know, sometimes people go, oh no, I'm not old enough yet. But if you're noticing something, come in.
And know that it's okay to ask your primary care doctor questions. Even if you're younger than the age that's recommended, it's okay to be educated early on and to prepare for that time.
Yeah. All right. Cholesterol screening, you touched on that, and that's one of those things that we think, okay, that's for old people.
Yeah.
Old people as in 12 to 13 about is where you start on that one.
Absolutely.
What are 12 and 13 year olds going through that I think a lot of us weren't aware of?
So a lot of times it's undetected in that age group because you wouldn't really think that they would have that issue, but family history matters during that time, and so there are predispositions that they're exposed to that are unknown, that when we screen for that, we're able to expose it and to prepare and plan better and differently as they get older.
Is diet a part of that too, or
absolutely,
lifestyle?
Yes.
All right, and we know this generation of kids is the processed food eating kids, and we'll talk about that. Yeah, Takis. We got food coloring there. We got all kinds of things going on with stuff like that. All right, cervical cancer screenings as young as 21, again, unless there's family history or something's going on.
Yes, and so the recommended age now, which is different from what it was years ago, is age 21. Wow. And it's recommended between the age of 21 and 30 to be screened every 3 years.
Okay, yeah, because that's another one that we thought was skewed much older. We're seeing that cervical cancers are showing up in younger populations, so not necessarily. Absolutely. Same with mammograms. At one point, it was kind of all over. It's like, no, 50, 60, no, this, that. And now we're saying 40 baseline.
40. And there are patients who are diagnosed with breast cancer at the age of 40.
Wow. Okay. And younger.
And
I mean,
younger.
I remember meeting a girl who was 18 who had breast cancer, but she was insistent on going in because she was something is wrong. And the doctor said, no, you're too young. And something is wrong. And they got it taken care of. All right. The colonoscopy, another one that we talked about earlier, which your grandmother passed away from. Conrad Bozeman was about 40 when he, and usually by the time it's stage 4, it's been there for a minute.
Yes, absolutely. And so again, you're emphasizing listening to your body. I totally agree with that and encourage that. And it's okay to ask the questions, but screening now for colon cancer screenings is at the age of 45, and you have options now. So the colonoscopy is a very specific test that you can get where you see the gastroenterologist to get it done. And then you have the Cologuard and then the actual stool fit kit. Colonoscopy is every 10 years if it's normal. Cologuard is every 3 years. And then it detects abnormal DNA in the stool. And then the fit kit is every 1 year.
Yeah, and then of course our prostate cancer screenings. We know too many men are passing away from prostate cancer if they had just gotten that screening. They'll say, well, I wasn't feeling anything. A lot of these things you don't feel anything until it's in advanced stages. Bone density screening is another one that's important.
Yes, and the bone density screening is important because it helps detect osteoporosis. Now, I will say that is more common in the older population, and so the recommended age to screen for that is at 65 and older.
But if you fall and break a bone, oftentimes that's kind of a downward spiral. So this way it just can help you, maybe like a Weeble, you fall down and you get back up, right?
And frequent fractures can actually be a sign for something is going on there. We need to look further.
Yeah, well, thank you very much, and thanks for letting us know, Dr. Simpson, about this new addition, which is kind of getting people before maybe hopefully avoid some more serious things. All right, to book an appointment with Modern Primary Healthcare, visit them online at modernprimaryhealthcare.com. You can also call them at this number right here, 832-966-3376. Again, 832-966-3376. I oftentimes have people ask me, do you know of a primary care physician? Because I need one. It's like, make sure you have that already, in your Rolodex. Oh, I guess the Rolodex is probably in your phone now. It's not necessarily, shows how old I am.